place is much more than simply the physical characteristics of where people live and work. Places shape and influence us all, and, in particular, where we grow up affects our chances of a long, healthy and successful life. The Scottish Government's initiative, Good Places, Better Health, brings together a wide range of health, environmental and design experts to explore the often complex links between the planning and formation of good spaces that in turn create and sustain good health, helping to tackle some of Scotland's intractable childhood health problems, such as asthma, obesity, unintentional injury, and a child's mental health and well-being, as they affect children from birth to 8 years.
Good Places, Better Health came out of a belief that the environment and people's surroundings were very important for their health. And Scotland, like every country, has its own set of health problems. And if you don't capture and address all the reasons why people's health is not as good as it could be, or importantly for Scotland, why some people's health is rather worse than others, then you're not really going to be able to make a difference. And we knew we needed academics, but certainly we also needed practitioners. We needed the professionals who work either in public health or environment. We probably needed the organisations outside of government who might be interested in environment and place and creating good places. But we also needed to engage with the public, the people who actually had their own experiences of environment, because it became clear to us that their feelings about environment were actually hugely important to how that environment impacted on their behaviour and their health.
Good Places, Better Health offers an innovative approach to understanding the complexities of place, neighbourhoods, communities and homes, and to finding more effective and inclusive ways to engage national and local stakeholders to help achieve a healthier Scotland. Only through organising to deliver can policies be shaped and implemented to make a real difference to the places where we live. At the heart of this approach has been extensive partnership working, the adoption of a multifaceted approach to evidence gathering and validation, and the use of a modified DIPSI model to examine each determinant and map its place within the whole picture, identifying action points at each step of the way.
The modified DIPSI model is a tool that we use to create a common language and to be able to communicate throughout the project. It is an acronym that stands for drivers, pressure, state, exposure and effect, and the important A, which is for action. We use it as a way of mapping out the relationship between place and health, and then be able to communicate with people on those maps and the relationships that exist.
We had experts on environment, we had experts on what we might call place, which is where environment interacts with social and behavioural and other features, and we also had experts who might be aware of the way in which environment can impact positively on health, not just negatively. So we had experts representing forestry, we had landscape architect, we had people who understood the importance of green space, which is a very important part of our surroundings and a very important influence on people's health, whether because it influences how they feel about places, but it also provides an opportunity for them to take exercise and be active, which is very important for their health in a whole range of ways.
Well, my training is as a scientist, but of course I live as a person. And you know that science, I love science because I think it gives you a formal way of understanding some things and a transparent and a public way of understanding things. And I think it has a special place. Well, there's an awful lot of things go on in the world that science hasn't shown, hasn't investigated and hasn't proven. And it's really important to capture not just what seems to be established through traditional research methods, but what people know and think they know. And there's a wealth of wisdom in that. One of the things I liked about Good Places, Better Health is that we looked to get good knowledge and information in lots of different ways. There is the traditional scientific way. What are the papers that have been published and what can they tell us? And we had very good people from universities of Aberdeen, Glasgow and other places, specialists in their areas, reviewing that evidence for us. But we didn't want to just stay with the formal scientific evidence. So we had workshops with practitioners, with people who work with communities close to the ground on what they knew and what they thought about how place affects health. And we had a whole series of workshops with people in different communities, mostly in communities that would be called deprived communities, not rich people living there, asking for their views about how the place they live in affects the children and how they get on growing up.
The prototype phase was embarked upon in December 2008 and considered the question, what is needed to deliver places that nurture good health for children?
We started from a point where this was a prototype phase. We didn't always know where we were going to end up, and that was both the exciting bit and the challenging bit of this project. So it meant that we had to learn a lot as we went, we had to tweak things as we went along, and we had to be prepared to go back and revisit our original thoughts. This was a true partnership project. We had a number of organisations taking the lead for a number of parts of the project, and they were tasked with different things that they could take forward, such as gathering information or holding workshops with experts. And then all of those partners came together to create what we called the Intelligence Partnership, and they were the people who were responsible for gathering the evidence, sorting through the evidence and making sense of it. And they were a partnership that worked together to produce the evidence assessments. The rest of the project was then consisted of a project team who sat within Scottish Government and that I was part of, and then also an evaluation group, which was an independent group of experts who were brought together to look at the evidence that had been gathered and to consider how they could translate that into a series of recommendations that could be made to Scottish Government.
The evidence developed then brought together in form of individual evidence assessments, one for each of the 4 priority health outcomes of asthma, obesity, mental health and well-being, and unintentional injuries. These were then developed thematically in a series of cross-cutting reports on neighbourhoods, housing, and transport, with recommendations in each of these areas.
The Independent Expert Evaluation Group of Good Places Better Health produced a report with 10 specific recommendations within it. These recommendations were based on a vision they had for the kind of place they would like children to grow up in. This included a Scotland where children spent much more of their daily lives outside and were able to explore, play in streets, green spaces, parks and open spaces. It also was about children being welcome in those places and that their parents and the wider community supported and valued their presence in the outdoors. The other recommendations that were important are around housing, and the Independent Evaluation Group felt it was important that children were provided with warm, dry homes and with adequate space for them to play indoors and outdoors near their home. The report also describes the importance of maintaining neighbourhoods so that they are safe and looked after, and that can create a good, strong sense of community, and that is very important to the ability for children to play outside. What was also highlighted within the report was a recommendation around a specific Scottish neighbourhood quality standard. This is something that the evaluation group felt would build on the health assets model for communities.
And a further legacy is how the partnership working, methodologies and approaches adopted can help bring together scientists, academics and policymakers to plan, gather, interpret and develop holistic and realistic outcomes.
Well, I think one of the really nice things about Good Places Better Health is that it tried to take everybody out of our little boxes. By our little boxes I mean the traditional ways that we put limits and blinkers on what we do. And there's a place for limits and blinkers. It allows you to get on and do things. But it's really important to step back from time to time and look at other ways. So this was very wide in terms of its view of the environment, not just place like this, but diet, for example. And it was wide in terms of the number of organisations and disciplines and backgrounds that people were involved with. Now, that's not entirely novel, of course. I mean, lots of other people have done that. But to integrate all those things together in one research programme was both interesting and useful.
The next steps for us in Good Places, Better Health are for us to think about how we can use the information that we've gathered to influence change, how we can take that forward to create better places for Scotland's children to grow up in. We also want to increase awareness with professionals around the role that place can play in creating a better and more equal Scotland.
Although changing our attitudes and actions on environment and health cannot in isolation solve all of Scotland's childhood health issues, they are a crucial part of a wider change, and we owe it to Scotland's children to create good places for better health.